Welcome to the Enterprise Mobility Roundup podcast, brought to you by Blue Fletch. We discuss technology topics related to Android and workforce devices and how they intersect with business and mobility.
Hello and welcome to another episode of the Blue Fletch Enterprise Mobility Roundup podcast. I'm Brett Cooper, joined with Richard Makerson, and today we're going to be going through a presentation that Rich will be doing at a healthcare conference later this year. I want to just cover some of the key points and topics and talk through them. If you do have questions on these, we will be fielding those at a couple of the conferences. We'll be at, I think we'll be at Health, we'll also be at HIMSS, and we'll be at Vibe as well. So definitely reach out to us if you want to meet up face to face. So Richard, the title of your presentation, I know we went through a couple of different iterations when you came up with it, but is 40 seconds long enough to save a life was I think what we ended up with, which was good. And I think the subcontext is the healthcare's blind spot, the cost of clunky UX. The word clunky, what made that come to mind for you as we were throwing these around?
Well, I wanted to come up with a title that was a little bit provocative, but also could be used as an AI prompt. Joking. But then, we've been really focused on user experience, whether it's been our consulting days at Accenture, early on at Blue Fletch. You and I have been the ones responsible for delivering technology to the end user. And you and I don't want to show up and someone says this is a hot pile of garbage, right? So we've done our best to make sure that we've thought about that end user experience, thought about that handover to make sure it's as best as possible. And so, that's just kind of one of our core values and ethos here at Blue Fletch. And so when you think about the clunky UX experience, you waste time, you introduce more clicks, and then it ultimately leads to frustration. And so I believe it was at one of the Zebra events where they talked about during a normal course of a day that a clinical user, whether it be a nurse or doctor, could have 1,000 interactions or taps on a device. And if those 1,000 taps, if a good percentage of them are frustrated taps, how much of that is just poking at the device or wanting to slam it because it's not doing what you need to do in an efficient and elegant manner. And so reducing that frustration is part of the value that we bring. And so just trying to highlight that and bring that into the healthcare context.
I've actually never seen any analytics around how many touches you have on your screen during a day. I'm just imagining I've seen, the kids when I pick the kids up from school, like all the kids like sliding and swiping on their phones, how many taps that an average person does in a day. But I think it's very provocative image is thinking somebody's going to touch their computer 1,000 times or their handheld device, and should they be interacting with a patient or interacting with the other clinicians in the staff. So it's definitely an interesting concept. And I guess the next piece of that, the 40 seconds, can you dive into why seconds matter or why those 40 seconds matter? What was I guess for us, why is that important?
Yeah, so analytics we've gathered and just tests we ran at NRF last year in the direct source booth, we saw that on average it takes an end user 40 seconds to enter in an email and a password. And in healthcare for these clinical mobility devices, when you're in a hospital and your whole job is about patient outcomes and, saving lives, those seconds really do matter. And so if I'm not having to deal with clunky UX or UI, if I can have an elegant experience, then it means that I have more time to focus on patient care, focus on my job, or maybe other areas or tasks that I have that aren't as efficient. And so for us, anytime you interact with a piece of Blue Fledged software, we want it to be a great experience so that hopefully, even in those other tasks that are not efficient, you at least feel better going into it. Or you feel good knowing that you're using some software where folks have thought about your flow, your workflow, and know how important your job is.
Make the app feel good. I heard you say this morning on the UX meeting. It's like, just make it feel good. I think one of the things just thinking about that, and it's 40 seconds, but how many times? I know we have a lot of companies. I think we have one company that has over 80 apps across their employees. That's not a healthcare org, but there are a lot of healthcare applications. These, whether you're a nurse or a PA or somebody in a clinical environment that has to use like. What have you seen for the customers you've worked with and the folks you've helped out? How many apps we see typically in a nurse's Zebra device or Honeywell device?
Yeah, in the healthcare setting, it may not be as big as some of our other customers. Like that one customer is an outlier, but they really have leaned into um, how much just value and efficiency they can gain by diving really deep into our product feature set. But usually it's somewhere between 4 and 10 apps. And so if I'm able to navigate those easily, if I'm able to serve up information on widgets without having to dive into the app, I can get information at a glance or make the patient interaction, whether it's on the bedside or the patient is under observation, and I can see notifications, I can see progress. It's just those, you know, small bites of the apple that add up over time, whether it's a course of a shift, over a week, over, months of, dealing with so many patients.
Yeah, it's interesting. When I know I talked to a doctor recently about this, and her feedback specifically was about the amount of paperwork during a shift they have to do, and how that there's
Mhm.
definitely a trade-off, whether it's on a computer or mobile device, versus actually working with patients and doing the job versus doing all the overhead associated with the job. I know you personally, you come from, I guess I got the question. You come from a healthcare family. I know your mom, your siblings are in healthcare. How are you the black sheep where you ended up in IT? What happened there?
Another doctor did a good job of talking me out of going into healthcare. So I thought I would have been some type of doctor graduating high school, going into college, but I like to tinker, I like to take things apart, understand how they work, make them better. I really love being able to go on the internet and just research how to solve problems and figuring it out myself. And with everyone around me and my immediate family being in healthcare, there was no one in technology that provided um, a mirror or a reflection to show that like I could go into this as a career. It just seemed like a hobby because the few folks that I knew that were in technology had other jobs, but they did that as a hobby. And that's why I went into technology. And now that we're starting to work with health systems and health systems globally, it feels like a big full circle moment that I, eventually ended back up into healthcare, but in a different way.
So at Thanksgiving, everybody is complaining about their technology to you, and you're like, I'm just gonna go solve this. I like it. The I think the other thing around the that you talked about was the a lot of these solutions, and we've seen this not just healthcare across different industries, is around technology for technology's sake or
Mhm.
IT. Like I always give the funny example. There's a incredible developer on our team, and I'll reference if I see something that looks like it was a SQL type query, like where it's just very poorly designed. I'm like, I think this guy did it. But there is this trade-off of the user experience or UX versus things that are designed for people or human centric. Tell me more, like what's your philosophy around like the moving fast from a tech perspective versus like thinking about the end user and doing the difficult solution.
Well, I think it's incumbent on the IT provider or that company to be able to take a step back and understand how do you strike that balance of compliance and kind of having a cover yourself strategy, for lack of a better term, versus being able to lean in and understand, how do you deliver like a great experience for that end user. And so I think as some of these companies either get bigger or grow through acquisition, you lose your ability to be able to lean in when you strike that balance. you start to rely on, check boxes, making sure that we're compliant and that, you can tap a badge and these apps are available. And that's it. What about the edge cases? What about spending time with end users? And I think just with our consulting background and years of building, custom applications, we look at it as software, and we really try to strike that balance, but that balance with knowing that we've done anything and everything to deliver, a high quality experience that when people come to work, they like the tools that they use. So if I got to do a ton of paperwork as a nurse, at least my rounds were easier because of the software that, Blue Fletch ultimately delivered.
I know one of the things, and I feel like we saw a shift in a lot of other industries. I know retail, particularly, and also some of the consumer apps. I always think of Home Depot and Chick-fil-A. They spent a lot of money in the teens where they went and built UX teams or hired UX experts, and it's very noticeable in their apps because they work well. You can find what you're looking for. It's really thought out. What do you think is the lag where we haven't seen that take as much in healthcare? Or it's not a leader. I look at healthcare. It's over in the U.S. It's over 20% of GDP, which is a very big number. It
Yep.
would seem that it would be the leader in driving some of this UX and just experience adoption. What do you think the key reasons for it being a laggard are?
Yeah, so let's unpack the Chick-fil-A and Home Depot example that you covered. Um, for us, I've always said in retail, specifically brick and mortar retail, Amazon over the last 15 years has forced innovate retailers to innovate or die. Um, a lot of your well-known brands that are not around anymore, for whatever reason, weren't comfortable innovating, didn't have the budget, didn't have the teams, and ultimately aren't here. And so you needed to lean in, you needed to invest and trust that, okay, if I'm going to compete with Amazon, I have this brick and mortar store, I have these employees, I need to create value and show that value. Chick-fil-A, on the other hand, just really cared about the experience, right? It's Southern hospitality. And so how do you lean into that? Not only, hiring great people, having a really great culture that's known worldwide, but allowing technology to drive that as well. That's why you can see a line wrapped around drive through wrapped around Chick-fil-A, but you're very comfortable getting in line because you know that they have video analytics. They're processing this and figuring out how they can deliver a quality meal, but very quickly and consistently to you. And so for, healthcare, it's different. It's not about selling tools or lumber or, fried chicken sandwiches and Polynesian sauce. You're in there because of patient outcomes. Lives are on the line. And so you really do need to take your time and understand, where is that balance from an innovation standpoint and a user experience standpoint. I, I mean, I may be speaking out of turn here. I'm not a doctor, not a nurse. I didn't go to med school,
Nor is he a
but
lawyer, so
nor am I a lawyer. But it was a badge of honor to work, double shifts for 24 hours or be in a 6 hour surgery. Part of um, the job was grinding through um, this delivery in order to save a life or make sure someone can have a good quality of life or deliver a baby. And so I just think because those the outcomes and delivery and the job is at a much higher stake, it is a laggard. But from us, not very little, but for us it's software. And so if the challenge is compliance, then we're very comfortable taking that step back and understanding how can we work to something that is great that will move the needle in saving lives, delivering better patient outcomes. So uh, I'll stop there before I continue to rant and keep trying to draw parallels.
now I just want a Chick-fil-A chicken sandwich. They're so good. I think I was going to ask you just case study and just experience. And I know there was we've done some POCs, and there's particularly one specifically around, I believe, improving the workflow for nurses with the paging tools and just some of those pieces. Can you talk about like what that hospital system wanted to do, and then what were the outcomes that happened once they started to thinking about the workflows for the patients?
Yeah. So typically, when customers come to us, and this is not any different in healthcare, it's because the that initial workflow of signing into to the device is not dialed in as what they want, right? There's edge cases. It's not just being able to go up to um, a docking station, tap a badge, I get a device, and then that's the only time I log in. What happens if I set the device down? What happens if another employee picks up a device? It's being able to solve for those edge cases and have an elegant solution. So being able to sign in, this healthcare system had, hundreds of hospitals, and so you're talking tens of thousands of devices. So how do you standardize on a platform that could work across all those devices in two different, or at least in multiple countries? I think it's more than two. And, sometimes tie together applications that don't traditionally support SSO, but you want an SSO-like experience. That's some of the value that we add. But once they started digging into the features and looking through the product a little bit more, they realized they can extract more value. So, now we can create accountability and understand who's doing what, when, and where, increase device utilization. The bigger you get, the more devices that you have. Statistically, you will lose some. But if you have the technology along with the processes to reduce or mitigate that, um, you'll be much better off than what you were before. And so, that leads to, you know, quickly getting into the device, understanding what your tasks are for the day, getting to your tasks in a more efficient manner just leads to, happier employees, better patient outcomes, and happier patients.
On that thread, I know the idea of human-centered design or human-centered UX is a thing people will throw out there, but give me like for the way you do it or the way we do it at Blue Fletch, the role-based, you pick up a device, it's customized towards you. What are some of the examples you've seen that benefits, whether it's in healthcare or even some of these other large organizations you work with?
It's just it creates flexibility to really fine tune that experience. And so if you have different levels of nurses that maybe need different access to applications, it could be as simple as you want the icon of that application to look different, or the label or the name to call it something else because it fits um, just the communication culture of your healthcare system a little bit better. It may be initiating a workflow for a particular user. I know we worked with a hospital system here locally in Atlanta that had zero compliance for this paging system. And so with us being able to log in automatically, um, kick that off, you could drive 100% compliance because the user doesn't have to worry about that. That's something that happens dynamically, automatically, and unbeknownst to them. But I really think it's the core of it is just years of being clean sheet development company. When big companies couldn't build it or buy it, they would call Blue Fletch. And so when Blue Fletch builds a product, we build it in such a way that it's highly configurable, highly modular. You can deliver it out of the box and it can work. But when you start to run into these edge cases that typically you cannot solve with some of these other solutions and providers, that's where we really shine. And so that healthcare system that you mentioned, once they saw that we could solve and be an alternative to the status quo from a sign-in and SSO perspective, they really started diving into the feature set and said, okay, we can really extract a lot of value here. And, they got really creative. And so I really get excited when customers get creative on our product. It does bring back some of that, consulting excitement that we used to have around here. And so it works for them, and that's what makes us different.
On just to dive into I'm going to call it the user-centric piece. I know one of the things that we have a there's actually a poster in the Blue Fetch office, and it says, "We build software that employees want to use." I think
Hmm.
that's sort of the summary of it. It's been up. We've had it up for 15 plus years, and I think the it's one of the things that you and I have always stood by, thinking about the employee who has to use this. And I say it, and people probably get tired of hearing me say it, but when you have software that millions of people use every day, think about how to improve their lives and do it with that. But I think when you look at the healthcare ecosystem and think about, what if all these companies thought about the nurse first? What do you think would change? What would we see different in the healthcare or clinical ecosystem?
I mean, having a better experience just means you're going to feel better, right? You're starting to think about reducing stress, reducing clicks, reducing calories of thought, calories of movement. Um, you're getting someone excited and it has a bit of a dopamine effect. And so I think because not much, I want to say not much thought, but when you think about workflow optimization, when you think about user experience, healthcare is not the number one example you usually hear, right? You usually hear someone in a different type of environment, in a different vertical, and so we've been doing that in these other verticals for a number of years, almost 20 years, you and I together, and so now to bring this into healthcare and bring it at a time where I think they're ready for it, especially when you think of what um, the challenges healthcare is up against, like in many other verticals, whether it's um, labor, when you're thinking about this younger culture, the expectations they have when they come to the job, they expect technology to be at least as good as the technology that they have in their pocket or at home or in their cars. And when it's not, they're frustrated. They're frustrated. They're going to be um, stressed, and if they're frustrated and stressed, that's not going to lead to a positive outcome. And so, I think we're around at the right time to be able to, address that and, meet workers where they're at. And I don't think, companies, especially in healthcare, historically had to um, highly consider that.
So I know one of the topics or slides in your presentation is unpopular truths, specifically around diving into that topic a bit further, that healthcare is behind a lot of other things. So your point, like what you have in your pocket is just so much more. What nurses have in their pocket is so much more advanced than what they have at work. What are some of the threads or things you identified around why healthcare is so far behind? Is it compliance? Is it the insurance companies? Is it the lawyers? Like what is the driver of them being behind from a technology aspect?
I mean, I think it's a little bit of everything. Y- you know, some of the conversations we've had around getting things through a security architecture review board in the
Is this the
past
one
has
where I have to
been
like print it out and then fax it back to them?
no, this is where they just don't approve it. And so the most secure thing is something that you can't use, right? Nobody can hack nothing.
Uh,
Um, but yeah, like when you look at, the HIPAA compliance and HIPAA laws, like when is the last time that's been updated or at least iterated on in such a manner that it can feel like it's evolving with technology. And like I said, like the stakes are high in healthcare, and so I get it. It's very easy to say not right now. That's too much because you are dealing with the lives and the health and um, the livelihood of people. But at the same time, um, we can have those conversations. You can have those proof of concepts, those pilots. It's just trying to figure out, what's that. pattern, or what's that ecosystem or that feedback loop, what is it going to look like for, um, the years to come, because technology is evolving so rapidly, especially you think about artificial intelligence and all the efficiencies that that's bringing, and how do you build guardrails around that, right? That's moving, you know, quick enough, and introducing that into a vertical that has been historically slow to change for good reason. Um, is going to reach a tipping point to where something's going to happen.
Is this where I talk about my idea of a fax machine that has AI built in?
Oh God.
So just to close out, if you, and this kind of brings us to like the end or tactical part, if you had to challenge healthcare organizations to think about what to go do next, like go do like this thing or these two things next, what would you recommend people start with? I know it's such a huge thing, all these different topics. Like, what is the easy thing for people to start with and just go pick things off? Where would you start?
Um, Possibly figuring out how to document and get feedback in existing workflows. I do think, at least for some of the IT teams we've interacted with at these healthcare systems, you could tell that they have like negative bandwidth. So how do you create the environment where they can still work, but also think about test, present options for what's next, and not, constantly be putting out fires, 24/7, doing blocking and tackling activities when they really need some bandwidth to be able to figure out, is Blue Flash the right solution or not? And if it is, how can we move forward with it? Um, and then, for some of the compliance and other pieces, that's probably, above my pay grade, and probably a whole different podcast when thinking about, HIPAA compliance, and, uh, you know, how does that evolve in a world where, um, all of our information is already essentially out there? Uh, how do you keep this safe? How do you keep it from hallucinating? Um, or what are the things that we can do now that, um, you know, maybe reduce the the paper workload of a nurse, um, you know, get them from behind, or keep them from desks where where they can spend time with patients, and have the bandwidth to, keep things top of mind and be ready for emergencies.
Awesome. All right. So two key takeaways: focus on those nurses, and then think about how to free up time for your IT teams to look at their processes and try to rationalize those and make those better.
Yep.
So Richard, thank you for going through this today. Like I said at the top of the podcast, Richard will be presenting this topic at some of the healthcare conferences we're attending later this year. Specifically, I believe Vibe Health and HIMSS, and we know we'll be at. Maybe some other ones we're going to be visiting. So if you're interested and you're around those, definitely reach out to us. You'll see us post about it on social media, mainly LinkedIn. And if you have any other questions or follow-ups for us, please reach out at info@bluefletch.com. And Richard, once again, thanks for joining and walking us through this.
Yep. Thank you.
Excellent. Thanks, everyone.
Thank you for listening to the Enterprise Mobility Roundup podcast. If you enjoyed the discussion, please take a few moments to rate us. If you would like to listen to future episodes, please subscribe. To learn more about mobility topics or submit any questions, visit us at bluefletch.com.